How's it going, guys? Past level question for hematology. 31-year-old woman who has a microcytic anemia despite a normal iron and ferritin. That's going to be thalassemia and USMLE. Answer is target cells. Now, you can't rely on target cells as a crutch because about half of USMLE questions are not going to mention them. And there are other causes of target cells, but they're low yield nonsense. Okay, target cells can be thalassemia. But this is what I want you to know. And you've been following my content, you know I've inculcated this. Number one, thalassemia is going to be a microcytic anemia despite a normal iron and ferritin, which is what we have here. The second way it's going to present is a microcytic anemia that is non-responsive to iron supplementation, implying that the iron and ferritin are normal, but she still has the microcytic anemia, it's thalassemia. Okay, sans some malabsorptive disorder, but we're not reading between the lines. So what's going to happen is if you have a microcytic anemia in a woman of menstruating age, 99 times out of 100, it's simply IDA, iron deficiency anemia. You go on to do our iron and ferritin, they come back normal. You say, oh, this is thalassemia. So you're going to do hemoglobin electrophoresis. And if you get increased HbA2, HbF, which is what we have here, alpha 2, delta 2 is HbA2, alpha 2, gamma 2 is HbF. These are both increased. It's going to be beta thalassemia. In an adult, beta thalassemia minor. Sick kid, beta thalassemia major. If the hemoglobin electrophoresis comes back normal, we have an adult, it's 1 or 2 alpha mutations for alpha thalassemia. If it's a sick kid, it's going to be HBH, it's beta 4 tetramer, 3 mutations. If it's fatal in utero, it's going to be gamma 4 tetramer, hemoglobin Bart's, hydrops fatalis. Okay, so here, if we had told you the hemoglobin electrophoresis is normal, it would have been alpha thalassemia. But here we have beta thalassemia. It's really, really, really buzzy and high yield. You know that. If they give you a 10-line paragraph and just say in the bottom line, hemoglobin HbA2 is increased, plus or minus the HbF also that they'll mention being increased, beta thalassemia. Okay, so you see target cells here. Now, thalassemia is simply you can't synthesize one of the hemoglobin chains properly. So you're forced to make other types of hemoglobin instead. So let's just hop through the other answer choices. Choice A, acanthocytes, is wrong. These are spur cells. They're spiky RBCs. You see these in liver failure. It can be heat stroke where you have hyperthermia, body temperature 104 plus usually, and causes end organ damage. So liver failure, renal failure, but they can mention acanthocytes. And the other thing is you can see them pop up in hepatitis B, C questions. Okay, so A beta lipoproteinemia, you can also see them, but it's liver failure that you really need to know for USMLE. Basophilic stipling's fucking around, so these are going to be lead poisoning. Are there other causes? Yes, but you got to know just lead poisoning. So these are rRNA precipitates. Wrong fucking answer. Choice C, helmet cells. Wrong fucking answer. It's just another way of saying schistocytes. It's a long seminar. Okay, hemolytic uremic syndrome, thrombotic thrombocytopenic purpura, disseminated intravascular coagulation, HELP syndrome in pregnancy, mechanical hemolysis due to prosthetic valves. Wrong fucking answer. Choice D, Hall Jolly body, is fucking wrong. Okay, so these are nuclear remnants seen with splenectomy. So it can be surgical splenectomy, such as post-trauma, let's say splenic laceration in an MVA car accident. It could be autosplenectomy, such as with sickle cell, where you get repeated microinfarcts and you lose the spleen. But they can mention Hall-Jolly bodies. Okay, I've seen them put those in stems and be very slick when they give you difficult diagnoses. For example, they can give you a vignette where it's difficult to discern that they're talking about sickle cell, but then they throw in that there's Howell-Jolly bodies, and you're like, boom, that's sickle cell because you get autosplenectomy. See what I'm saying here? Choice D, wrong fucking answer.